Namaste and welcome to yet another conversation, and this is something I've been looking forward to. He's a regular into Bharat, but he's not a regular on TV interviews. So Mark Suzman, CEO of the Gates Foundation, Namaste. Welcome to Bharat yet again. What brings you around this time? And I think there's something special. It's perhaps the first time that the board of the Gates Foundation is also with you?
Yes, well, it's special for two reasons. One, it's the 25th anniversary of the Gates Foundation this year. And that's a moment to look back and look forward, think about what we've done. And for nearly the entire lifetime of the foundation, we've been working in India. It's where some of our most exciting work has been, and it's where we think some of our most exciting work will continue to be. So this is also the first time we brought our entire board to meet here to both do our board meeting, but also engage directly with some of the very exciting partners and innovators and government officials and others across Bharat. And that's the occasion.
No, so you are somebody who's a regular in Bharat. You tend to fly under the radar and you're doing a lot of work. So we're going to catch you the next time around in action. But what was the board's thought? Did they come with a particular perception, and did it change when they landed here?
Well, I think it's changing, because while I'm speaking to you now, I put them all on a plane early this morning to go to Lucknow in UP. So we started in Bangalore. We were meeting with the life sciences, biosciences hub there. We met with a number of philanthropists in the ecosystem. We met with a number of agricultural research pioneers here on Monday. Some external partners, and then we had our board meeting, and now we've sent them off to UP to see some of the work we're doing in health and education and financial inclusion. And I think they've just been really impressed by what I've seen over the years, which is how India really is a place that can take innovation and pioneer it and turn it into what I like to call human impact. Results that really do benefit the poorest and most vulnerable. And that's the core mission of the Gates Foundation. And that's really what we were trying to think about, get excited about, but also think about what more can we do together in the future.
25 years of the Gates Foundation is also 25 years of the Gates Foundation's engagement with Bharat, right? How have things changed? How have you seen Bharat evolve? Let me ask you from your perspective.
It's so in extraordinary ways. So both the foundation and Bharat have changed dramatically, but just in those 25 years, we've seen a 2/3 reduction in maternal mortality, a 2/3 reduction in under 5 child mortality here. We've seen 400 million people lifted out of poverty. It's been an extraordinary journey of progress, which you can only really appreciate given the size and scope of Bharat. And in each of those, there have been lessons that as we have slowly expanded. We started in some narrow areas of health. We've expanded in broader health, agricultural development, financial inclusion, education, all of it working very closely with the government. And particularly in the last decade, we've seen a greater focus, a greater commitment to the needs of the poorest and most vulnerable. Bill and I met with the Honorable Prime Minister yesterday to discuss and look back at some of the partnerships with that. And I think it's been an amazing story of progress and work together that we are both very proud of what we've been able to do, always in partnership with the government and people of India, but also to take now some of those lessons. We think there's a real opportunity for enhanced global leadership of some of these Indian models of development that we can take in Africa and other parts of the world.
Before we get to the thick of what all you are doing, because you said last decade there's been a significant push, and that last decade is largely under the leadership of Prime Minister Modi. How have your interactions with him been? And where has his focus been when he's interacted with you?
Yes, well, when he came into office, one of his very first initiatives was the Swachh Bharat program, which was a sanitation program. And sanitation has been a major priority for the foundation. Let me tell you, this is the only country on the planet where the head of state made a commitment to sanitation as an early. It's not normally seen as people don't want to associate, but it's very impactful for the needs of the poorest. And I think it's been a model that has since taken us in many of the other areas where we work, whether it's been around helping enhance primary health care and immunization programs, whether it is about nutrition programs and enhanced nutrition particularly for pregnant mothers and young children, whether it is about agricultural development focused on the needs of smallholder farmers, particularly women farmers. That's always been a clear priority of the Prime Minister. It came up again in our discussions yesterday, and that filters down into the country. It actually helps provide the enabling environment that allows us to partner, because clearly as a foundation, we can't deliver outcomes ourselves. That's not our role. What we can do is we can provide some technical expertise, some support, some understanding of where some of the world's best practices are, try and graft them into the local Indian context and make them work. But in the end, it only succeeds if it's driven by the Indian government itself, whether it's direct service delivery or whether it's the enabling system for philanthropy or private sector providers.
Tech and innovation, it's a changing world. And in your core line of work, tech, AI is something which is changing over in minutes, not even, let's say in seconds, the world changes. How has the Prime Minister's approach been with you and the Gates Foundation in embracing and using tech for social good?
So if we think about digital tools broadly, India has really been a pioneer in what we think of, and the phrase we use within the foundation is frugal innovation. And frugal innovation is a massive compliment, because you're trying to think, if you want innovation to benefit the needs of as many people as possible, you need to make it as cost-effective as possible. What is the reason why global vaccination coverage 25 years ago was low? It's because vaccines were too expensive and out of reach for large parts. India today produces 60% of the world's vaccines. High quality, low cost vaccines. We've partnered with all the major companies, Bharat, Serum and others, to help make that happen. But that is what's triggered not just in India, but globally. Take that in other areas. The DPI agenda, the digital public infrastructure, what India has done off the baseline of the Aadhaar Universal ID, now of the digital payments structure, the UPI system, the digital stack is now a platform which provides low-cost services which even in India, a decade ago, no one would have thought you would be doing. I was doing a little transaction off my phone at a partnership in Bangalore, because we've partnered now with the government of India and some philanthropic partners with this institute called MOSIP, which is essentially taking the UID, the Aadhaar model of a digital identity platform, and it's now in 16 other countries, going up to 25 countries. And that's exactly the kind of odds. And the Prime Minister has really been a champion of that. And we saw that in India's leadership and hosting of the G20 a couple of years ago, where the digital public goods agenda became a central deliverable. And we've seen that now carried on through the Brazilian G20, currently the South African G20.
But did you think it was going to be possible at the first interaction, and let's say the last decade, because most of the ground that you've covered, the Gates Foundation in Bharat, has been in the last decade. Did you at point, is this mere lip service? Is it actually percolating down to the ground? I saw Bill with the drone Didis, and I'm sure you're also there doing something interesting, although it didn't get captured in the reels. But do you really see it percolating down on ground?
Yes.
You said that it's not just word, it's percolating down. But did you think it'll happen the way it is happening?
Not to the degree we hoped, but you never know. And let's be clear, the track record, not just in India, but in most countries, is very uneven. That there can be grand commitments made at a political level, but follow through the system, through the bureaucracy, through the private sector ecosystem, often is very uneven. And I think what's happened here is that follow-through has actually happened. And that's happened at the national level, and it's increasingly happened at the state level. So we also partner in a number of states. Historically, we've partnered most deeply in states like Bihar and UP, although we now work across AP, Meghalaya, Assam. We have a wide range of partnerships. But if you just take the case of UP again, we had worked and have a memorandum of understanding where we've been developing to technical support, particularly in healthcare, also in agriculture. And there, it would have been slow to see the initial results. The first few years of our partnership didn't generate results. But now, if you look at some of the statistics in UP, and this is the reason we've sent our board there today, so they're off visiting a health center in Lucknow that we've helped support, the improvements in basic maternal and child health care, recently some of the improvements in basic education, literacy, numeracy, are stunning. And I don't need to tell you, UP is larger than 95% of the countries on the planet.
Yeah.
And so when you're achieving success there at scale, which is sustained, that's a model. And you see that across the country. And I think it's that consistency, that it's not just lip service, that it's actually then reflected. It's reflected in the budgetary priorities that come through. It's reflected through the system in each of the ministries, where each of the ministries. We also went to visit the Niti Aayog on Monday, Bill and I, and we've supported and worked with them in their aspirational districts program, their model. That's exactly a kind of model where, if you think back 10 years ago, they're tracking the progress. We sat in this room, which we helped them construct. It's a bit like the Starship Enterprise, where you can click on a state, on a district, on a block, and you can see what's happening in agriculture or healthcare or education. And that shows commitment and follow through, because it also shows you where the gaps still are and what more still needs to be done, because it's an unfinished journey.
And I've seen this Starship-like kind of thing. But when you sit there in the room and you click the button and you see this is what's happening in these districts, and when you do go down on ground, do you see that there is perhaps a linear alignment there, or is it disparate? What you see back at the control room and what's happening on ground?
Well, it's not completely linear, but what that allows you to do is identify where are the best practices happening. Some models work, some don't. So take the issue of AI-enabled agriculture services. So we've been working for a couple of years. Actually, Bill Gates last year visited some of the early work in Odisha. And what we've been trying to do is put together in a single app that's AI-enabled, that a smallholder farmer can use, that will be done in the local dialects, and it will actually provide the weather forecast for the next few days. It will give you the direct soil mapping, so it'll tell you what the consistency of soil and what kind of support you might need for fertilizer. It'll tell you which crops will be most effectively grown in your soil. It will tell you which services from the ministry or benefits you might be able to get. Is it a fertilizer subsidy? Is it a subsidy for mechanization? And all of those are put in a single unit that actually, from that testing, you then find what works. You get the demand from the farmer. We're now scaling up a similar model in Bihar, and I think we're going to see state-based models of that all over India in the next year or two. And so what you take is learning which bits work, you make the course corrections and adjustments. What looks good from Delhi is not always what's going to work on the ground when you're out in a rural area, but it's that feedback loop, and that's also where I think the Indian government at both the national and state level have become much smarter and more effective, using the data from the feedback loops to course correct and then implement the more effective policies.
The Gates Foundation has been involved in health. It's been involved in improvement, overall socio-economic development. You've been involved in education in Bharat, and you've been doing a lot of work. Which for you has been the region where you feel you've taken the biggest stride, the biggest transformation has happened? And where do you think, perhaps you could have done this, or had this happened? As you look back into 25 years.
Yeah, so that's a difficult question to answer, because it's like asking which is your favorite child. And we're proud of all the work we've done. Clearly the bulk of the work we do, the majority of our thing, is in the healthcare sector. And so in the end, looking across those indicators, those numbers, those reductions in maternal and child mortality, those are those are India's numbers. They're driven by the Indian government, but we're so proud to play a part of that. That's millions of people living healthy and productive lives today who might not have been able to a decade or so ago. And if you were to come, and I extend an invitation to visit our foundation in Seattle, as well as taking you into the field on my next visit to Bharat, you would see on our building, when you walk in, our vision is simple. It simply says, every person deserves the chance to a healthy and productive life. That is the core value of the Gates Foundation. It's why we do all the work we do. And it's so inspiring to see, first, the survive. You need to do the preventable deaths. No mother should die in childbirth. No child should die unnecessarily for lack of nutrition or vaccination. But now what we're also seeing is that movement into the thrive. How do they then grow up into healthy, productive members of society who